Good afternoon, everyone. My name is Kenny McKinnon, and the title of this presentation is Detransitioners and Retransitioners, Experiences of Gender-Affirming Care. This study is funded by the Social Sciences and Humanities Research Council. And the aim was to explore the gender-affirming care experiences of individuals who stopped or reversed a gender transition in connection with a change in gender identity or expression, referred to as detransition. We use constructivist grounded theory as a methodology. To invite participants, study flyers were circulated over social media to clinicians in 6 Canadian urban centers and within participants' social networks. Eligible participants were Canadian residents aged 18 and older with experiences of stopping, shifting, or reversing a gender transition, and 28 participants consented to participate. Individuals with experiences of detransition were consulted throughout the study, and our team includes trans and non-binary and cisgender researchers, and some of us have experience of detransition. We interviewed participants about their experiences of transitioning and detransitioning, and following constructivist grounded theory, interview data were analyzed inductively and thematically to interpret participants' experiences of and recommendations for gender-affirming care. Among the 28 participants, there was a wide age range, 20 to 53, 71% were between the ages of 20 and 29, 64% were assigned female at birth, 57% reported more than 3 past gender identities, and 57% indicated a mental health-related disability. The age of medical transition was a majority of individuals initiated medical transition age 24 and under. In terms of race and ethnicity, the majority were white and 18% were multiracial. The vast majority of individuals initiated medical transition through the WPATH assessment model, and participants did not experience the assessment model as gender affirming. Some participants felt that this model, together with long wait times to access assessments required for publicly funded surgery, contributed to questioning their gender and detransitioning. Participants also felt a need to prove themselves as binary trans, and some pursued interventions they didn't necessarily want at the time because it was required to access surgery. One participant shared, "In my early 20s, I started to look at what is gender, and I've never identified as a man. I pursued top surgery. I got switched to a different psychiatrist who's awful, who said, 'You can't be trans because you don't want to be on testosterone.' I had to prove that I was trans enough in order to access surgery. I don't regret top surgery for a minute, it's just the testosterone." Most felt providers' informed consent practices were inconsistent with the principles of informed consent, such as having robust discussions about a range of treatment options and their known risks and benefits. One participant noted that insufficient medical research focused on gender-affirming hormones placed limits on the informed consent process. So she said that there aren't enough studies about the effects of hormone replacement therapy. Several others felt that looking back, they would have benefited from more clearly understanding themselves and desire for transition and consent practices adapted to their age-specific developmental needs. One participant shared, "I started testosterone at age 15. I was presenting as very, very masculine and was in the system. The people I was working with, the group home staff, had brought in this gender identity specialist, and they asked me, 'This is transgender, are you this?' And I'd never heard of it before. I also saw it as a portal to escape, like my girlhood, AFAB childhood. And there was a formula. I didn't ask for it, it was kind of a given. And they said, 'This is what you need to be, you're a trans man. You're agreeing with this, and this is what you need to do. And when you take testosterone, these are the side effects.' I wasn't viewing it as this is something I'm doing for the rest of my life. This is something that's going to impact my social life, my romantic life, the way I see myself, the way I like myself, my body." Another participant shared, "I was just sort of screened for general mental illness. I feel like I deserve better care in a sense, but they actually took time to figure out where those thoughts with wanting to be a boy were, why I wanted to go on testosterone. I was so young at the age 15 at the time. Like I wasn't even really thinking about these things. I was just thinking I want to get away from being a girl. Today, my gender expression is not where I'd like it to be, but that's for a future thing." Many participants experienced a mental health decline after beginning their transition, and so many felt that more accessible mental health care offered alongside gender-affirming care was important. Several participants also explicitly endorsed having access to patient-led neutral therapy, which was thought to engender a more clarity toward understanding themselves. Overall, participants endorsed autonomy in decision-making, but many felt they were missing key information to make informed treatment decisions and desired more mental health supports. 1/3 felt decisional regret and desired a more comprehensive assessment and/or neutral therapy in order to explore their gender. Others didn't feel that was necessary. This is consistent with what other studies have found that sampled detransitioners as well. Finally, gender fluidity does occur across the life course for some people, and patients need to fully understand this in the context of long-term satisfaction with medical interventions. Thank you so much, and I really look forward to interpreting and discussing further these study results. Thanks so much.